I'm Zaid Shalchi, and today we're going to be talking about retinal vein occlusion. So retinal vein occlusion is a very common condition. It occurs when a blood vessel draining the retina becomes blocked. As a result, the retina upstream from the blockage can develop bleeding, swelling, and poor oxygen supply. It's one of the most common conditions that can affect the retina. So in terms of symptoms, some people will notice no symptoms at all from a retinal vein occlusion, particularly if the vein occlusion is small or mild. Some people, however, may notice a sudden loss of vision, whereas others may get blurred vision or floaters. So are there risk factors? And the answer is a definite yes, and by far the most important risk factor is high blood pressure, which typically occurs more frequently as people get older. Eyes with glaucoma or ocular hypertension are also at higher risk of developing a retinal vein occlusion. More rare risk factors include blood clotting abnormalities and systemic inflammatory diseases. Let's talk about the types of retinal vein occlusion. Broadly speaking, retinal vein occlusion can be central, hemi, or branch, with a central retinal vein occlusion affecting the entire retina. Branch retinal vein occlusion is 3 times more common than a CRVO, a central vein occlusion, and only affects 1 quadrant of the retina. All vein occlusions can be ischemic, which are more severe, or non-ischemic, and these are less severe. And so the question is there any treatment for a vein occlusion? And the answer is most definitely yes, and it's actually one of the most treatable conditions affecting the retina. Now, untreated, it can lead to visual loss, but treatment can be very effective, as we said. Previously, laser to the retina was able to stabilize vision, but now injections into the eye can improve vision and keep it good. Typically, patients will need a course of injections, and there are many drugs that can be used for these injections, and they've all been shown to be effective. In eyes with ischemic retinal vein occlusion, laser can help reduce bleeding and retinal detachment.